Hey everybody, this is Dr. Mitch Ghen. I am the Chief Medical Officer of Hue Light USA, and welcome to the Daily Dose. Now, we discussed in a previous episode pretty much about osteoporosis, osteopenia, and hopefully from a different angle than you've thought of before. Well, now it's time to start a series on how do you consider treatment when it comes to osteoporosis, and I want to do this from a completely different angle than our traditional approach. So I want to first start off by quoting an author, Dalia Ali, who in the Journal of Bone in 2020 basically said, I quote, "Bone marrow adipose, or that's fat tissue, is a unique adipose depot originating from bone marrow stromal cells and regulates bone homeostasis and energy metabolism. An increase in bone marrow adipose tissue volume is observed in several conditions like obesity, type 2 diabetes, and osteoporosis, as is it known to be associated with bone fragility and an increased risk for fracture," unquote. Well, basically what that author was saying is that if you increase the amount of fat cells in the bone marrow, you're going to have actually a bone marrow or bone that's weaker than normal. Makes sense. So the converse of all this is, what can we do to pretty much change that? What type of things can we add? And this particular author found that resveratrol exerts a protective effect against inflammation, oxidative stress, and the human bone marrow stromal stem cells. So the stem cells that are inside the bone marrow actually became stronger, healthier with the addition of taking that thing that everyone talks about that's in red wine called resveratrol. Now, we also know that these stem cells are called mesenchymal stem cells. You might have talked or heard about it in transplants. Well, these cells are pretty much easy to transplant in anybody because they are what they call non-privileged. They can go from one human being to the next. No, it isn't okay to do that currently in the United States, but elsewhere it is being used readily. But what we should know is that resveratrol, this little tiny type of nutraceutical, inhibits fat differentiation of the human bone marrow mesenchymal stem cells and reduces their cell death. What that means is there is an increase in what we call osteoblastic differentiation of the cells. Sounds like a mouthful, but what it actually means to you, that if you take a respectable dose of resveratrol every day, that the particular cells that make bone, called the osteoblasts, begin to encourage. They get larger. There's more of them, and they actually make the bone stronger. For more of this type of content, please follow us or ring that bell below, because we have so much interesting things coming more your way. Thank you for watching the Daily Dose. I'm Dr. Mitch Ghen, the Chief Medical Officer of Hue Light USA.